A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
I am so pleased to welcome Dr. Philip Bailey with us today, a renowned doctor, homeopath and author. Philip has done so much work for homeopathy and has got a whole set of books that you are going to be interested. Welcome.
Thank you, Mary. It's lovely to be here. Thanks for inviting me.
Tell us a little bit about your homeopathic journey, how you got here and your involvement with homeopathy.
So when I was at medical school in London, training to be a doctor, I already knew I was more interested in the mind than the body. But I didn't really want to do psychiatry because it was so drug-based. And while I was still a medical student, I started hearing about homeopathy. In particular, I joined a meditation organization that had a lot of homeopaths in it. So I started getting homeopathic treatment and even studying homeopathy before I qualified in medicine. And by the time I qualified in medicine, I realized that I'd like to study in homeopathy because I can treat mental and physical illnesses without drugs, basically. So that's what I did. When I finished my training in medicine, I did my compulsory year as a house doctor in the hospital. And then I went to the London Homeopathic Hospital. In those days, there was still a I don't know if it's still there, but NHS Homeopathic Hospital in London. So I was able to continue working in conventional medicine and at the same time study and work with homeopathy. From there, I also did some study with Misha Norland at the School of Homeopathy in Devon, and studied with going on seminars with George Vitulkas. And when I was like 3 or 4 years after I qualified as a doctor, I then moved to Bournemouth and joined a homeopathic GP practice and started my work as a homeopathic GP, basically.
Oh, fantastic. And we don't have an awful lot of those left in the UK now, do we? Or do we?
Well, actually, I've been away from the UK for so long, I'm not sure. I moved after a year and a half in Bournemouth. I moved to Australia, and so my practice for 18 years was in Perth in Australia. And there are very few homeopathic GPs in Australia. I'm not sure how many are left in England.
Yeah, not many allowed practicing. All the hospitals, of course, have shrunk right down. I think we've just got 1 or 2 left. Now, the first book that I read of yours was Homeopathic Psychology. Tell me a little bit about how that came around.
Well, as I said, my interest right from the start was more on the mental side than the physical side of people's ailments. And so I quickly learned the psychological profiles that tend to go with certain remedies, particularly the remedies I was seeing more often. And because I have a kind of natural affinity for the psychological side of medicine, I got a deeper understanding, I felt, of some of these psychological profiles than was available in the books at the time. If you read a description of, say, Lycopodium or Pulsatilla, they were very basic and sketchy. And I felt, well, I could do a better job than that because I have a considerably more nuanced understanding of this psychological profile. So after I've been practicing, I don't know, not that long, maybe about 8 years, I felt, I could write a book about these psychological profiles, which I did, and sent it to a publisher, and they didn't want it. But they then suggested how I could modify it and make it more organized and that kind of thing, which was great advice. And after I did that, then I found a publisher, and the rest is history in a way.
Fantastic. So tell me a little bit more about your prescribing methodology and how that's developed over the years.
I'd say, like a lot of homeopaths, it's what I call classical homeopathy, which is looking for one medicine that fits the whole person at that time. And I've tended to to identify what I consider as the constitutional remedy or the remedy that fits the person long term. And I know there's a bit of a debate amongst homeopaths whether people even have long-term constitutions, but I tend to find they have. Like I do find that people that respond to sepia more often tend to have long, straight black hair and things like that. So there's even physical characteristics that fit the constitution. So I tend to look for the constitutional remedy, which is the one that fits the person's physical and psychological characteristics long-term, and then prescribe that remedy, unless there's been an acute change recently, like a trauma, like a grief or a car accident, or something which has totally overlaid the usual picture with a new symptom picture. If that's not the case, then I will look for the long-term constitutional remedy. And I do go a lot on the psychological profile. And when I look at the psychological profile, a lot of it is on the feeling of the client, on the language that they use. Two people might objectively say the same thing, but the feeling is totally different and they need different remedies. So I tend to look for the constitutional remedy, prescribe that remedy as a single remedy, and it may be a daily dose, for instance, in an LM potency. I very much like the LM potencies if it's a chronic condition. Or I might give a single dose of a 1M or a 10M to have a deep but rapid action, and then follow up over several months.
Okay. Did you always use LM potencies? Did you work into that?
No, I came across them after I'd been practicing for maybe 5 or 6 years. Another homeopath got talking to me about LMs. This is what tends to happen.
Yes.
We learn from each other, and the other homeopath pointed out the benefits of LMs, particularly that they were deep and gentle at the same time. So if you wanted to go gentle, I used to go like a 30C, or if I wanted to go deep and affect, like particularly the psychological characteristics long term, I might give a 1M, but the problem with a 1M is it wasn't gentle. So you might bring up a lot of aggravation of symptoms before an improvement is seen. So I found using the LM potencies that I could affect people on a deep level, but gently, by giving the remedy every day. And so for most of my career now, I've been using LM potencies probably more than any other way of using homeopathy.
Oh, okay, that's interesting.
But I will often give, say, an LM3 or an LM6 for maybe 3 months until the patient has improved considerably, and it's also very clear that this is the correct constitutional remedy. And then I might want to go deeper and then give a 1M or a 10M to either cure the case or just to go deeper in terms of cure.
Tell us a little bit more about your new book, Lac Remedies.
You say new book, it's probably a few years old now, but it is my latest book. The first big change in my own prescribing came when I discovered Jan Scholten's book about homeopathy and the elements, because it suddenly gave me maybe another 100 remedies to use as constitutional remedies. But then the next thing that happened to me in the years following that was discovering the Lac remedies and finding that they were quite common amongst my patients as constitutional remedies. I think initially I had a patient that had some strong Lac features, such as poor bonding with their mother, and a tendency to rescue people, and an inability to receive nurturing. So I already knew these as Lac features from my reading about Lac remedies. But the other thing about this patient was there was such strong feline characteristics of this patient. She was very kind of tactile and very sensuous, and she adored cats and she looked feline. And so I almost couldn't resist prescribing Lac Felinum, and I looked up Lac Felinum, it fitted very well, prescribed it, and she responded beautifully. But after that, over the coming weeks and months, I started seeing more and more patients that fitted the Lac features in general. There are many Lac features, particularly psychological features, such as identifying with the suffering of women and children, or inability to receive nurturing, a sense of campaigning for injustice and this kind of thing. So I saw many cases that fitted these remedies, and I had to learn almost from scratch, well, which Lac remedy fits this case. So I had to study with the available literature, whether it was a human milk or cow's milk or lion's milk. And just from experience, I learned over the next 2 or 3 years a lot of information about particularly the psychological profile that fitted each of these lac remedies until I could prescribe with confidence, most of these lac remedies. And then I felt ready to write a book, because again, the books that were out there were quite sketchy in their information on the lac profile. So once again, I wrote the book. It was kind of partly for enjoyment, and I really enjoyed writing.
Fantastic. So there's a whole lot of information in there that takes it one step further, really, than we're able to read about currently.
I hope so. Yeah.
Do you have any favourite remedies?
I think every homeopath has favourite remedies. One of my favourite remedies has always been Medorrhinum. Whenever I get a Medorrhinum patient, I love that patient. It's like I find them so enjoyable to be with. And I also feel I have a lot of similarities with Medorrhinum. So I've taken Medorrhinum myself, and it doesn't work for me. So it's not my remedy, but I just find a lot of attractive features in Medorrhinum. They tend to be very passionate, very open, very adventurous. And they have a nice balance between earthiness and imagination and emotional sensitivity. So yeah, I've always been very attracted to Medorrhinums. Lac Felinum is another one that I find I enjoy being with. Similar reasons, actually. They can easily be confused with Medorrhinum. They tend to have that combination of earthiness and a kind of spiritual sensitivity and an adventurousness. And of course, there are also remedies that are just very entertaining because they're so out there, like Argentum nitricum and sulfur. I just enjoy being with some of these clients.
Can you tell us a little bit more about Lac Felinum? Because it's not one that is used an awful lot. Obviously, it is quite a bit in your clinic, but it's not one that people will generally have heard of. Tell us a little bit about how it differs, perhaps, from Lac Caninum. Yeah,
well, Lac Caninum is the best known lac remedy because it's been known about for the longest, but it has a very extreme picture psychologically. The self-worth is very low in Lac Caninum, and emotional stability is very weak. So they're very unstable and always putting themselves down. It's a similar picture with Bromium, this very low self-esteem and emotionally very unstable. You get a much more balanced picture with Lac Felinum. In fact, you get a picture which resembles sepia and carcinosinum. I find often my very most difficult task is deciding between these three remedies. Sepia, Lac Felinum, and carcinosinum, they all have a strong tubercular element. And by that, I mean that they like stimulation and they like physical adventure. They like new experiences. So Lac Felinum has this kind of restless, adventurous spirit. But being a lac remedy, it's very, very sensitive emotionally. So if you compare it to, say, tuberculinum or carcinosinum, there's even more emotional sensitivity. And also being a lac remedy, there's a struggle with opening up to intimacy and opening up to love. So it's rather like a cat in the sense that they want, they don't want. There's this ambivalence. Ambivalence is a very good word for Lac Felinum, and it differs from carcinosinum and sepia. With Lac Felinum, they have this ambivalence about whether to get close and whether to let you close. And so, particularly with their love relationships, there's this loving people at a distance or having a long distance relationship, or being with a man who's married, or being with a man who lives a long way away, because they want that closeness, but they don't feel completely comfortable. So that ambivalence is a essential feature in Lac Felinum.
That's really, really interesting. I'm looking forward to reading that a lot more. Tell me, how does your homeopathic prescribing differ perhaps from other homeopaths?
Well, I think when I learned homeopathy, there were about maybe 35 remedies that we considered as constitutional remedies. And they're the ones that I put in my first book, Homeopathic Psychology. These days, we know that there are hundreds of constitutional remedies. And so nowadays, when I see a client, I don't have a fixed picture that it's got to fit into one of these 35 remedies. Now I'm open to literally hundreds of remedies. And I find a lot of homeopaths are still in the old way of thinking, that they're still limited to maybe 30 or 40 constitutional remedies. And so they actually don't get such good results because, in fact, they're excluding a lot of constitutional remedies that might be needed. For instance, I very often get a case where the client fits a snake remedy. They have certain features which fit the snake remedies, like they don't like things done up tightly around their neck. They feel jealousy very easily, or they need a lot of fresh air. And whenever they go to a homeopath, they get given lachesis, simply because it's the only snake remedy that the homeopath knows very well.
Mm-hmm.
But they don't respond that well to lachesis. And so when I get a case that's being given lachesis, I will study it, and usually I see it's a different snake remedy that fits very well. And you get better results when you have a choice of 10 snake remedies instead of one snake remedy. So that's one difference. I use a lot more remedies than some homeopaths use.
Would you find that the same with the spider remedies as well? Because of course we've got, one or two spider remedies that we know really well and just don't know enough about the others.
Yeah, and I still struggle with spider remedies. And recently reading a couple of books about spider remedies, it's helped a lot, because there's always new information coming out. So before I would know either it's tarantula because they were quite functional and quite extrovert, or it was another spider remedy because they had a lot of spider features, but it didn't fit tarantula. Nowadays, with the help of these two other books that I've been studying, I've got a better chance of finding which spider remedy. But I do find most homeopaths just give tarantula or just a spider remedy. And again, usually it doesn't work, or it works a little bit. So it's the same with birds, it's the same with spiders. It's actually the same with all remedies, because if someone's gentle and yielding and feminine, often a homeopath will give pulsatilla, but there are actually so many remedies that are gentle and yielding, but quite a few homeopaths have never heard of. And these days I'm using remedies that I hadn't heard of a month before. So homeopathy is actually quite difficult to practice well, and it requires that you're constantly learning. Recently I came across the book, I don't know if you've got it, Wondrous Order, by Mikhail Yakir.
No,
have you seen that? Right? It uses plants in the same way, or it gives a system for using plant remedies in the same way that Shelton gave us a system for using mineral remedies and elements. So there is a periodic table of plants, and I'm finding it's wonderful to use, and I'm starting to use plant remedies that I'd never even heard of before as constitutional remedies. So it's really blown the whole picture wide open. Like now, the other day, prescribing dandelion or taraxacum as a constitutional remedy. Without the help of her book, I would never even consider the remedy. And it worked so beautifully on a client that I'd been treating for 3 or 4 years and not getting anywhere with various remedies. And then giving dandelion, the whole remedy came into order. The whole case came to order.
Okay. So what you're saying, just by finding the extra remedies, it just means that we can really fine-tune and get into the psychology of a patient much closer.
That's right. When you've got 35 to choose from, you're usually going to miss, because in fact there are hundreds of constitutional types, and therefore there are hundreds of personality profiles. So really you need to learn a lot more than those polycrysts that we used to learn, and you will get much better results once you've learned a wider range of remedies. Of course, homeopaths find it difficult because it can be overwhelming. So like when Shelton's book came out, they said it's overwhelming to have 100 new mineral remedies.
Yeah.
But the way I learn is I learn case by case, and that makes it a lot simpler. I get a case, it doesn't fit the remedies I know, then I study Shelton, I study 1 or 2 other authors until I find a remedy that fits that case. So I don't have to go and learn all the 100 Shelton remedies. I just pick and choose until I find a new remedy that fits this case. And that's the way I learn all my remedies, really. Yeah.
Okay, perfect. Because you're absolutely right. Once you've gone through the journey with a client with the remedies, and you just see it, don't you? It comes to life.
Very often what I see after taking the case is I do not know this remedy. It's like I know after taking the case, either this is a remedy I'm familiar with, or it's a remedy I don't know. And then if it's a remedy I don't know, then the research starts, which of course is always exciting.
Yeah, that's what we love, isn't it?
Yeah.
So tell me, is homeopathy always enough? Do you ever use other medications or other remedies alongside homeopathy?
Well, I trained first as a medical doctor and then as a homeopath, and then I trained as a psychotherapist. So I've always used all 3. And very often I've had clients that needed both conventional medicine and homeopathy. They did better on the combination than one alone. Okay. So, for instance, someone with asthma, I might need them to continue taking the puffers until the homeopathy has had time to stabilize the asthma. And it might take a couple of months of homeopathic treatment before the homeopathy has got on top of the asthma. And in the meantime, they will need their inhalers.
Yeah.
And also, if in future they get a severe infection, they might need an inhaler again until the homeopathy has got on top of it. So I've never been strict in terms of don't use conventional medicine. I've always used them both. It's the same with vaccinations. A lot of homeopaths are anti-vaccination, and I've never been anti-vaccination.
Yeah.
So I've always used conventional medicine. And if you get a severe infection like meningitis, I wouldn't be confident giving a homeopathic unless the patient was a Jehovah's Witness and refused to take an antibiotic.
Yes.
You know, some conditions, the Western medicine is extremely effective and safer than using the homeopathic.
Yeah. I think it's a really important thing for us to stress, isn't it? The fact that homeopathy does work well with other medications. We are certainly not saying it's instead of, it's alongside, it's complementary.
They go very well together. For instance, you might have a patient with a osteoarthritis of the hip, and the hip has worn away till it's just bone on bone. Now, you can give homeopathic remedies like Rustox or Arnica and reduce the pain, but ultimately they might do best with a hip replacement and can be completely pain-free. You know?
Yes. Yeah, no, I completely understand that. We could talk all day. This has been absolute pleasure. Thank you so much for giving your time and coming to talk to us. Have you got a website, something that people can look up further what you're doing and your books?
I do. I have a website, and there you can read about my books and also about the sessions that I offer online, which is homeopathy sessions and psychotherapy sessions. So the address is drphilipbailey.net, and the doctor is just DR, so drphilipbailey.net. And there you can find it out to contact me if you wanted to learn about my books or about the consultations that I offer.
Perfect. Thank you very much. Thank you.
Thank you, Mary. I've really enjoyed it.
Thank you, Philip. That was such an amazing discussion. I have so much more to go and find out about the Lac remedies. I hope that was of interest to you as well. Now, next week, we will be talking to Caroline Masters, and she will be discussing anxiety. So performance anxiety, fear of going on an aeroplane. We're going to look at some remedies and be talking about the homeopathic choice, the natural, gentle medicine that can really help break the cycle of fear. I look forward to seeing you then.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.